Hey y'all, it is your favorite doctor, Dr. Ijeoma Nodimapara of Wayne Health and Wayne Mobile Health Unit. See, I got it out there. I got it, Mobile Health Unit. Listen, we are still here at the 313 Day Health Fair organized by our wonderful Dr. Alicia Shelby. All right here at Dr. Lavon Sheffield Library. And look who I ran into, if not this fantastic, phenomenal sister. I can't wait to introduce her to y'all and for y'all to learn more about her and the work she is doing. She has a fantastic story. Don't we have fantastic stories? Yes. And so this is my wonderful sis, Lakeisha. All right, and you tell us more about you and sort of like tell everybody about you and the work that you're doing.
Okay, hi everyone. My name is Lakeisha Simpson L. I am a certified clinical hemodialysis technician with Henry Ford Health. I've been a tech for almost 7 years, and I have a book out called Hypertension and Hemodialysis: The Silent Treatment on the Rise. This book is very personal to me. My mother, 14 years ago, she had chronic illnesses with diabetes and hypertension, and she was a dialysis patient. So she was the first dialysis patient I've ever encountered. I never knew anything about it before I became a tech. So fast forward, I became a tech. I deal with multiple patients, different diverse backgrounds, ethnic groups at 2nd Avenue Dialysis. And the story behind my book is we have a lot of 20 and 30-year-old patients that are on dialysis, and they're becoming younger and younger, and it's because of the dietary lifestyles that they have. The hypertension is running rampant in our community. As you can see, it's so many different dialysis units that's on corners of our communities because of the chronic illnesses. And so I'm here to network and spread the word about better dietary lifestyle changes, stress management. Those are very important in our today's society. So we really need to get the word out and spread the word, and that's what I'm here to do. And I really appreciate being a part of this event, coming out on my day off. So
yes, we're so proud of you, Sister Lakeisha, because you wrote a whole book.
Yes.
And listen, as someone who's trying to write a book herself, it is hard. I don't even know how you did that, but it's such a labor of love, and we're so glad that you put your expertise and experience into a written form so that we can read and learn.
Yes.
And now some people might be watching this and asking themselves, what is dialysis? Can you explain in very simple terms so that my 5-year-old can understand what is dialysis? We want to kind of level set, because these conversations are about us celebrating our health, our lives, learning from each other as well, right? So so tell the people, teach the people what dialysis is.
Okay, dialysis is a medical treatment that's either performed at a hospital or a clinic to clean the blood. So basically, we clean the blood and remove the fluid. And the reason behind that is when your kidneys fail or you are in kidney failure, you have to go to a dialysis center, and the dialysis machine helps clean the toxins out and remove fluid that your kidneys would normally do. So it's basically an artificial kidney.
Correct. It's an artificial
So
kidney,
the patients come 3 days a week, and they get the proper medical treatment. We calculate how much fluid to take off, and we basically clean the blood of all the toxins until the next time they come for treatment. So they come 3 days a week, and depending on their labs, we know if their kidneys are fully gone, or we also determine if they have to go through a transplant. But it's usually a transplant, especially at stage 5 kidney failure.
Correct. So when your kidney failure is pretty advanced, ultimately the goal is for us to not require dialysis, right? And when our kidneys fail and can't work anymore, we really are we need new kidneys, essentially. And the goal is to get transplant. But in the meantime, because transplants are not just like fruit on the tree, just go pluck and get, right? So in the meantime, you still need some help to do the work that your kidney's not able to do, and that's where we get dialysis. We got 2 types. We got hemodialysis hemodialysis, there's a machine, it goes into the system, it's a whole treatment, and you go to a center for that. And then you got something called peritoneal dialysis, or PD, you might hear. And that oftentimes people can do at home.
Yes.
And either way, it does the work of the kidney when your kidney cannot do its work anymore.
Absolutely.
And like our good sis has taught us, one of the leading causes of this is hypertension and diabetes, both of which are preventable.
Yes,
for
it
the
is.
most part.
Yes, it
And so
is.
talk to us a little bit, Sister Lakeisha, about the ways that you have, because you have a personal story as well with hypertension.
Yes.
And how did you take care of it? What are the things that you did?
Okay, well, I developed hypertension when I was pregnant with my sons, and then I still had it a little bit after each son. So what I started to do is lower my stress management, because as you know, being a career woman, there's stress and different lifestyle, things that goes on. So I started getting rid of red meat. I started eating more fruits and vegetables, working out, and managing my blood pressure. And so I naturally did that without the medicine. So that's very important. And hypertension is a silent killer, just like chronic kidney disease is. A lot of people don't know that they have it, and they don't know the signs and symptoms. And a few of the signs and symptoms are swelling in hands and feet, constant headaches, and also a lot of people don't know taking a lot of over-the-counter medications can also damage your kidneys as well, along with excessive amounts of alcohol and drug abuse.
And cigarette smoke. Absolutely. But that's a very powerful lesson, community, which is that hypertension is a silent killer. Oftentimes people, the first presentation of hypertension is a stroke.
Yes, it is.
Is a heart attack. And that's what we don't want, right? Is that advanced kidney failure and now needing to leave the hospital, needing dialysis. So we want to prevent that, and our good sis has done the good work of showing that it is possible that when we take control, now there's some things that might be out of control, but God help us, there are some things that are within our control.
Absolutely.
And the ways that we eat, and in the ways that we handle the stresses of life, and in the ways in which we get active and move around, that we can do something about preventing the need to get to kidney failure requiring dialysis or transplant. So there's some things that can be helped, but there's some things that can be helped.
Absolutely.
And sis, just so you know, I can relate to you, because I too developed high blood pressure or hypertension after my third baby, and y'all know I have 3 beautiful coins. And so after my 5-year-old Chimamanda's birth, I also developed hypertension, and then it became chronic hypertension. And so I also had to do the work of losing weight. I was really heavy as a result of that pregnancy. I had to start eating differently. I had to start moving, and I always stay away from the word exercise, because sometimes people think I need to go to the gym, I need to push weights, and it's about movement. It's about movement.
Even
And
if
getting, or what, dancing. That's my thing, y'all. I dance. Yes. And dancing is to whatever rhythm, whether it's to the lyrics or to the beats. It don't matter as long as you're moving and you're having fun. Roller skating, again, stretches, yoga, tai chi, whatever you can do to get that heart rate up and keep it moving. Walking if you can. But that movement, but more importantly, really looking at that nutrition. That's where it really matters. And I had to really make a change in the ways that I ate, to eat more whole foods, the way that foods grew up from the ground. I still eat a little meat, and that's my business. But I had to really look at that. So I really appreciate that, because what we're not going to have in my household is kidney failure and needing to be on dialysis. However, if you already are on dialysis and you are on the transplant list, it is still important to do these things to take care of yourself. Isn't that right, Sister Lakeisha?
Absolutely, definitely, indeed. And just one other thing, before a lot of patients that come in with the dialysis, it starts with the heart first, and then it moves down to the kidney failure. So usually a patient that's already in heart failure, usually their kidneys are next to go. So
and again, because the whole body is connected.
Absolutely.
So if it's affecting your heart, it's probably already affecting your kidneys. It's just not shown up yet until it does. It's gonna affect the liver. It's gonna affect the blood vessels, and the list goes on, because the body is connected. But the good news is that we can do something about it. Isn't that right?
Absolutely.
As you did. Well, we really appreciate this conversation, Sister Lakeisha. Again, tell the people, if they want to follow up with you, how can they reach out to you? If they want to get your book, what do they need to do?
Okay, well, my business email is Queen Moab, QUEEN MOAB 88 @gmail.com. My book can also be found on Author House website, Amazon, and Barnes & Noble.
And what's the title of the book again?
My title of the book is Hypertension and Hemodialysis, the Silent Treatment on the Rise.
By author Lakeisha
Simpson L.
All right, it was so good to chat with y'all on this topic.
Thank you, love.
Yes,
Reach out
look,
to me.
That's right. Reach out to her. Reach out to all our good people.
Absolutely.
And Detroit, we
Yes.
are working. We are getting
Love you,
healthier.
Detroit. It's for you.
Yes, and we are living longer, honey. Yes,
Absolutely.
we are.
My book is called Hypertension and Hemodialysis, the Silent Treatment on the Rise. I speak on my mother being a dialysis patient, and I have been a certified clinical hemodialysis technician for 6.5 years. And I also talk about my personal professional experiences with being a tech, and my patients, and my struggle with hypertension at the time, but when I was pregnant, of course. But yep, so this book is for the community. It's for you, Detroit. Reach out to me. Again, my book is on Amazon, Author House, and Barnes & Noble's website. And my email address is Queen Moab, QUEEN MOAB 88 @gmail.com. Thank you.